Hello everyone, I am Dr. Said Mehbul Kadir from Bangladesh. Now I am going to talk on the tumors of the lacrimal sac. I have no financial interest to declare in relation to this presentation. We know the lacrimal sac is the major component of the lacrimal drainage system. The lacrimal drainage system disorders are relatively common, but the neoplasm of the lacrimal drainage system are rare in our clinical practice. The malignant neoplasm of the lacrimal sac can potentially be life-threatening. A study reported on 1264 orbital tumors, of which only 2 originated from the lacrimal sac. A French study only found 2 lacrimal sac tumors out of 1705 eye and adnexal tumors. Lacrimal sac tumors may be primary, secondary, or metastatic tumors. Given their rare occurrence, approximately 894 cases of the tumors of the lacrimal drainage system in defined case report studies and few large case series studies have been published in the literature worldwide from the 1930s to the present day. About 72% are malignant. All malignant tumors tend to be locally invasive and high recurrence rate. Each category of lacrimal sac tumors being further subdivided into benign and malignant. Most tumors are, however, primary and epithelial. Among the benign tumors, epithelial origin is about 60% and mesenchymal is about 31%. Of the malignant tumors, close to 72% are of epithelial origin, followed by 17% hematolymphoid tumor, 6.4% mesenchymal tumors, and 3.5% melanocytic tumors. Benign tumors tend to be present in younger adults, where malignant tumors typically occur in the 5th decade of the life, with age ranges reported 22 years to 94 years. In order of frequency, benign lacrimal sac tumors include squamous cell papilloma, transitional cell papilloma, oncocytoma, mixed tumor. Non-epithelial benign tumors include fibrocystocytoma and a spectrum of solitary fibrous tumor, previously known as hemangiopericytoma. Epithelial malignant tumors include squamous cell carcinoma, transitional cell carcinoma, mucoepidermal carcinoma, and adenocarcinoma, and non-epithelial malignant tumors include hematolymphoid tumor and malignant melanoma. The lacrimal sac tumors presented insidiously of dacrocystitis. The study reported that 53% patients presented with epiphora or tearing, 38% patients had a history of recurrent dacrocystitis, and 36% patient presented with a mass in the lacrimal sac area. Bleeding from the puncta or the nose, telangiectasia, ulceration over the mass, and tenderness may be found in some cases of malignant tumors. In benign tumors, the mass is elastic in consistency with distinct margin and is freely movable under the skin. On the other hand, most malignant tumors can grow rapidly, become indurated and hard, non-compressible, and with a firm adherence to surrounding structures and development of a fistula tract. Telangiectasia overlying the mass, bleeding from the puncta or the nose, and dark bloody nasal discharge may be found in some cases. Some proptosis or dystopia are observed with significant orbital extension. Diagnostic approaches of the lacrimal sac tumors includes thorough comprehensive ophthalmic examination, endoscopic nasal evaluation, sac patency test, and radiological examination. Surgical biopsy and histopathological analysis are important in all cases to confirm the diagnosis and tumor type and thus plan for further treatment. Imaging is essential for identifying the location, size, extent of the lesion, assessing the disease severity, and differentiating tumors from infectious and inflammatory lesions. CT scan of the orbit or paranasal sinuses with axial, coronal, or sagittal images are used to diagnose the lacrimal sac tumors and to assess osteolytic changes and the invaded surrounding tissues. A benign lesion is typically defined as well-defined lesion without any bone erosion. Bone erosion indicates a primary osseous lesion or malignant lesion. Lesion involving the lacrimal sac area may look hefty, irregular, and associated with bone destruction, which is highly suggestive of malignancy. CT, DCG, and MRI of the orbit can also be done for assessing lacrimal sac tumors. NI and colleagues offered 4 stages for the evaluation of the lacrimal sac tumor. Stage 1, in which there are symptoms and signs, but no definite tumor mass is seen or palpable. Stage 2 include obvious tumor formation is confined to the sac. Stage 3 include lacrimal sac tumor extends into the parallel sinus or into the orbit. Stage 4 is characterized by evidence of metastasis. The treatment of lacrimal sac tumors depends on tumor type, malignancy, size, extension, and patient's general health. The aim of the treatment is complete tumor removal. In cases where perioperatively unsuspected tumor is inadvertently found during routine DCR surgery, which has been shown to be 5% to 37%. The lacrimal sac tumors, especially malignant tumors, are better managed by multimodality treatment by a multidisciplinary approaches, and management strategy varies from patient to patient and center to center based on available facilities. Long-term, even lifelong time follow-up is required as recurrence or metastasis can occur after many years of primary treatment. Lacrimal sac tumors depends on tumor type, malignancy, size, extension, and patient's general health condition. The aim of the treatment is to complete removal of the tumor, and oncologist reviewed all patients to prepare a plan for neoadjuvant or adjuvant treatment. The lacrimal sac tumors, especially malignant tumors, are better managed by a multimodality treatment by a multidisciplinary approaches. Long-term, even lifetime follow-up is required as recurrence and or metastasis can occur many years after primary treatment. Open biopsy is preferred over fine needle aspiration biopsy. Excision biopsy or DCT is better option with a clinically evident lacrimal sac tumor. An incision biopsy may be performed on a suspicious lacrimal sac tumor. Poison section biopsy can confirm tumor type and help evaluate margin clearance. The treatment of malignant sac tumors is usually a combination of surgery, radiation, and or chemotherapy. Post-operative radiotherapy, especially if there is bony or lymphatic invasion or neoplastic cells in surgical margins, or chemotherapy may be indicated for tumor clearance and to minimize recurrence risk. Radiotherapy 50 to 60 Gray is recommended for malignant epithelial tumors. Recurrent case may require further surgery and radiotherapy. In certain cases, radiotherapy may be palliative. For suspected epithelial or mesenchymal benign tumors confined to the lacrimal sac, a dacrocystectomy without osteotomy may suffice. A planned modified DCR can be done at a later date after histological confirmation. In case of malignancy, intact or en-bloc tumor excision together with the periosteum of the lacrimal sac and lacrimal duct is advocated to avoid spread of tumor cells into sinuses. For more advanced tumor, dissection of the lacrimal drainage system with adjacent orbital or lateral nasal walls may also be required. However, if there is radiological evidence of tumor extension beyond the lacrimal drainage apparatus, then more radical surgery, such as orbital exentation, lateral rhinotomy, or paranasal sinus dissections and or cervical lymph node dissection may be necessary. Now I am going to few case report. This patient, a 37-year-old female, presented a swelling in the right lacrimal sac area. Coronal CT images reveal an elongated moderately enhanced lesion of the right lacrimal sac area. Excision biopsy was performed and histological diagnosis was low-grade non-Hodgkin lymphoma, but immunohistochemistry confirmed the diagnosis reactive lymphoid hyperplasia. There are four main treatment options for periorbital lymphoma, include surgery, radiotherapy, chemotherapy, and immunotherapy. Immunotherapy can be used in combination with radiotherapy or chemotherapy. Prognosis depends on the efficient TNM staging, histological grading, patient's comorbidity, and toxicity of the treatment. But the overall 5-year survival rate is approximately 60%. These patients, 21-year-old male patients, presented with non-tender mass in the right lacrimal sac area. CT scan showed a homogeneous lesion involving the right lacrimal sac area. Excision biopsy was done and histological confirmation a spectrum of solid fibrous tumor that was hemangioperitocytoma. Case 3, this patient, 56-year-old male, complained of non-tender lesion in the right lacrimal sac area. Axial CT scan show irregular heterogeneous lesion involving the right lacrimal sac area. Deep incisional biopsy was done and histopathology confirmed the diagnosis mucopurulent carcinoma. This patient, a 65-year-old male, represented a palpable growth in the left lacrimal sac area. Axial and coronal CT scan showed a heterogeneous lesion. The lesion also involving the left medial rectus muscle. The excision biopsy was performed and histopathology confirmed the diagnosis adenocarcinoma. This was recurrent case of adenocarcinoma. We started few cases study on lacrimal sac tumors, which is published in the past 30 years. The study reported that the most common features is palpable mass in the lacrimal sac area, then epiphora. The common tumors is epithelial and primary, and the epithelial benign tumor, common epithelial benign tumor is squamous cell papilloma, and common epithelial malignant tumors is squamous cell carcinoma. And non-epithelial malignant tumors include lymphoma and melanoma. We also studied few case reports on lacrimal sac tumors, which was published in the 21st century. The result is same as the case series study. The most common tumor is primary and epithelial origin, and the most common tumor is malignant. The most common tumor is squamous cell carcinoma in the reported cases. Our case series study on lacrimal sac tumors, published in high indexing journal Ocular Oncology and Pathology, published in January 2022. Our study reported benign tumors accounts 30% and malignant tumors accounts 70%. Excision biopsy and cystectomy was the initial modality of surgery. Lymph node metastasis was found at the time of diagnosis in one case, and most common tumors was non-epithelial malignant tumors, that was hematolymphoma. The total hematolymphoma tumors was 5 cases. Among the hematolymphoma tumors, 1 was benign tumors and 4 was malignant tumors. Recurrence was noted in 1 cases in our study, that was adenocarcinoma. Prognosis depends on the tumor type and extension and of the treatment. Benign tumor, especially inverted pattern, reported recurrence rate up to 40%. Squamous cell carcinoma reported 50% recurrence rate and mortality up to 50%. Non-keratinizing squamous cell carcinoma showed worse prognosis. Hematolymphoid tumors showed variable prognosis depending on type of the tumors and extension of the tumor, and malignant melanoma showed fatal prognosis. For the diagnosis of the lacrimal sac tumors, require high index of suspicion. CT scan of the orbit of paranasal sinuses is the preferred imaging modality. Early and appropriate workup and multimodality treatment may be needed. Careful inspection of the lacrimal sac during routine discharge surgery is mandatory. Long-term, even lifetime follow-up may be required, especially in the cases of malignant tumors. Thank you.